Eddie, how are you today? Thank you for joining me for today's weekly update, and today we'll be focusing on COVID and Omicron and the challenges that we face here in the state, which mirror the challenges that our country faces and every state faces across the nation. I'm joined today by Dr. Jose Romero of the Department of Health and Secretary Johnny Key with the Department of Education. First, let me make a comment about testing. As you know, I was out at UAMS today where we greeted the 10 National Guardsmen that are there assisting in the testing at UAMS. I am delighted that they have that assistance, and whenever you look at people waiting in line for an hour for a test, we want to be able to make sure that we can move them through the testing line so they get their test, they're not discouraged and go away. As I mentioned, a lady who had a daughter went to a testing line and saw how long it was and got discouraged and went back home. And we don't want that to happen. And so I have directed not just the 10 National Guards to assist here at UAMS, but I've talked to General Penn. I've authorized the deployment of an additional 50 National Guard across the state to assist in deployment, to assist in testing, and we're working with the Arkansas Hospital Association to identify the greatest areas of need. That's just our effort to make sure that testing continues to be available in Arkansas. These are the PCR tests. They're the most reliable. We also want to enhance our at-home test. As I announced last week, we've ordered 1.5 million home tests. There's a national shortage. We're ready to deploy those. We're waiting those to be delivered. We hope that they can be timely received. But in talking to the White House today, they also have an order for 500 million home tests that they will distribute, but it's probably going to be the end of January before they're available. So we want to be able to beat that. We hope we can. We've placed that order, and we're working hard to get that. And I want to thank the Hospital Association for their assistance. Let's go to the case report, and as we go through the case report, I'll cover some items that are important. First, in terms of cases, yes, today is the highest number of new cases reported in one day since the beginning of the pandemic. Regretfully, we have three different high marks in terms of the pandemic in our reports today. The new cases of 6,562. You'll also see later on that we have a record positivity rate of 25.5% over the last 7 days. And third, the active cases are at a record high as well. This tells us that we are entering a period of probably the greatest risk and the greatest challenge that we faced during the pandemic. At the beginning, there was so much that was unknown that made it a real challenge. Today, we have greater tools to work with. We have Omicron here that is less severe, but at the same time, the sheer volume of numbers as it moves forward gives us challenges that we haven't faced before. And so we have a lot of work to do during this coming month, and we hope that this goes down quickly, but we've got a lot of work to do between now and then. If you go to the next one, you'll see the doses given out. We've given out 9,400 vaccines over the last 24 hours, which is better than what it's been over the last week, but it is still lower than what it needs to be and much lower than what it has been in previous weeks. And that's a little bit puzzling to me with the volume of cases that are out there, the people that are waiting in line, and the risk that is present in our community. So we hope that that will increase. If you go to the next slide, you'll see the hospitalizations, and we have 53 new Arkansans that are hospitalized as a result of COVID. 3 additional on ventilators. And while I'm on hospital space here, let's stay here just for a moment. And we are looking to the future. We are doing planning. We recognize that two things can happen. One is that the severity is not the same as it was in Delta with Omicron, and therefore we have this huge, massive increase in cases, but you don't see the same level of increases in hospitalizations. That appears not to be likely, and even though Omicron is less severe, we are seeing, because of the sheer volume of cases, that you're having an increase in hospitalizations, and 53 is a significant increase in one day. We're going to monitor that carefully, but in the meantime, we do have plans to increase hospital capacity if needed. It is our surge plan, and as you know, we've invested over $60 million over the last year in expanding space in the hospitals for ICU, medical surge beds, and that's going to pay dividends in the event we have to once again increase hospital space. The challenge, of course, is the staffing, and the Department of Health will be leading the effort to coordinate with the hospitals what resources are needed to open those beds up again if we need that, and we are making those plans for the future. Let's go to the next slide on testing. As you can see, we had a lot of tests that were done over the last 24 hours, over 13,000. And then you can see again Pulaski County with 1,332 cases, Washington County coming in with 472. These are large numbers of cases in these communities, and of course it's across the state as well. And then if you go to the next one, I like to see this because this puts it in perspective of the entire pandemic. And so this is March of 2020, and we thought we were spiking here, and then we had another spike, but actually it was one gradual spike in December of 2020. We go down, and then we come back up in the summer of 2021, and now both of those previous peaks are overshadowed by the enormity of the peak that we are facing because of Omicron. And then next we'll see the hospitalizations, and this puts in perspective again that while we're up at 775, that is one half of where we were at over 1,400 last summer. But what I'm reminded of by Dr. Romero, and you can see it in the graph, that the increase in hospitalizations is very, very steep and comes very quickly. And so we hope that will not be the case with Omicron, but if we have that kind of steep increase, we're looking at significant increase in numbers and hospitalizations over the next couple of weeks, which we want to be mindful of. Active cases, you can see, are up. I've already talked about that. Then you go to the reminder once again that of our new cases, 82.5% have not been vaccinated. Of the hospitalizations, 86%, almost 87% of the hospitalizations are those people who have not been vaccinated. And deaths, of course, are 85% as well. Just statistically, a reminder of the importance of being vaccinated. And the booster shot is a critical part of the vaccination program that is really important as we look at Omicron. Arkansas residents, this is sort of a good example for us where 73% are fully vaccinated, but if you add the partially and the full together, you have 87% of our senior citizens that are vaccinated. And we want that to increase, but you contrast that to the general public. The next one, you see, if you combine these two, it's down to 65% of our population at least partially vaccinated. What's important is the fully vaccinated 53.1. So I encourage everyone to get fully vaccinated, including the booster shot if you're eligible for it. And then again, I mentioned the high positivity rate. that we have of 25.5%. That is a record, and you can see how steeply that has climbed over the last week. And just going back to the school districts, if I might, while that is there, I wanted to say that in August of last year being 2021, I announced that 500,000 high filtration masks would be sent to the schools for their use. This was done. These masks were manufactured in Mountain Home and shipped to the education cooperatives, who then shipped them to the different schools. At that point, it is up to the schools to get them distributed, and if any parent or any school district does not have those masks, then you need to look in your inventory, because they have been available. Obviously, last summer we saw the cases go down, but now they're up, and so make sure that those have been received and that they are available and that they're being used. And if any school district has a shortage, let the school Department of Education know. They have sufficient federal dollars to purchase the PPE, and it's useful. And as you know, the schools have the option to implement a mask mandate based upon the recent ruling of Judge Fox. And statistically, according to the Department of Health, school districts that have had a full mask mandate, students and staff saw a reduction of 25% in their COVID-19 case rates. And so I know that each school district will be looking at that as an option. Many of them have already taken action, looking at their vaccination rate, their case rate, their positivity rate in their community, and that's a decision for them locally, and it's a tool that they can use. With that, let me ask Dr. Romero to come, make his comments, and then Secretary Key will come and talk about the schools.
Thank you, Governor. So a couple of comments and new developments. We remain concerned about hospital bed capacity for our children. That is a group that is particularly vulnerable because of, as I mentioned before, we have one excellent children's hospital here in the state with a satellite campus in Northwest Arkansas. So there is a chance that with a larger number of cases, we could overwhelm that system. I'm encouraging parents to please vaccinate their children. Today, the CDC director authorized another dose for children with immunocompromised conditions, a third dose like we do for the older individuals for 5 to 11. She's also authorized a shortening of the interval between the primary series of the Pfizer vaccine and the booster. So now that has been shortened to 5 months from 6 months. And I believe the ACIP, the advisory group of the CDC, will be discussing boosters for the 12 to 15-year-old group. Again, if these are authorized, please, parents, take advantage of this at their appropriate time. We need to decrease the possibility of the children becoming symptomatic and being in the hospital. We are monitoring this very closely. New data, again, from the CDC published this week shows that these vaccines are safe for the 5 to 11-year-old group. We're not seeing anything unusual, and we're not seeing cases of the inflammatory heart disease that you can sometimes see with these vaccines. It's called myocarditis. Again, I want to reassure the parents that these are safe and effective vaccines. And lastly, as the governor showed in his last slide, the use of masks is essential for preventing transmission of this virus, especially in the schools. Use them. We encourage their use, and as was recently ruled on by Dr. Fox, this is a possibility to set up a mandate within the school if they're so deemed as appropriate. But please use the mask. That's the safest way of preventing infections if you're not vaccinated for children. Thank you, Governor, and I turn it over to Secretary Key.
Good afternoon. I want to share with you A couple of points of data that we have found very interesting as we complete the first semester, or have completed the first semester of this school year. If you look at the first semester of the 21-22 school year across the state, we had 54 modifications that were made by our school districts. And most of these modifications were made at either the building level, sometimes even a specific grade level. That compares to the first semester of the 2021 school year, where we had 411 across the state. And so this morning I had a communication with, and a meeting online with superintendents, and reiterated that the reason we've had a successful school year to this point is because of the work they have been doing with their teams in implementing the mitigation at the school level. And so my message to them and to our listeners today is when it comes to schools, we need to stay the course. We need to continue to focus on these mitigation techniques and steps, and use them and stack them in a way that will help continue to have a safe learning environment for our students. Obviously, some things have changed from last year to this year, one being the availability of vaccines. We think that has been, we know that has been one of the key points of why our schools have been able to continue with minimal modifications. In staying the course, that's not to mean to stand pat. We want them to review their current methodologies. We want them to review their current staffing patterns, their schedules, and as they get into this new semester, looking at their data and working with us to make sure that their response is a proper response and that they can continue to make those mitigating efforts. And I'll just reiterate what the governor mentioned on the masks, just to kind of put an exclamation point on that. We understood at the beginning of the school year that there would be a need at some point in the school year for masks to start the school year off right. But as the governor said, our case counts at that time were low. There are districts that may still have these masks available, and that is something we are encouraging them to do, that if they have these in stock, this would be a very good time to get these out and use them. I was on the phone with Mr. Poore with the Little Rock School District just a little while ago, and that is the situation there. Some of their buildings actually did receive the masks at the beginning of the school year. Some of them did not, but he assured me that they are looking to distribute all of the masks that they have in stock. So if you're a parent of a Little Rock School District student and you're concerned that your child has not received a mask, then I would encourage you, as the governor said, to contact your building principal to find out what that distribution schedule will be, when they will become available. But we will be following up with districts around the state to make sure that those needs are being met. And with that, I'll turn it back to the governor.
Thank you, Johnny. And with that, we'll take any questions.
Is there a point where you would consider reinstating the public health emergency and implementing some type of mitigation measures like a mask mandate?
Whenever you look at whether there should be an emergency reinstated, that depends upon the need for emergency powers. And so that's always an option down the road. But right now, there's not any additional actions that I need to take, executive actions that would require the assumption of emergency powers. And we know what we need to do. We have vaccines out there. We have the ability of local school districts to make decisions. Local governments can make decisions based upon Judge Fox's ruling. And so I think that we're set, and there's not any need for that declaration at this time. We'll continue to look at it and make decisions day by day.
The law was struck down so that mask mandates are now allowed in school, but do you encourage those? There haven't been a lot of changes in the past few days since that.
Well, I would ask every school district to affirmatively look at whether mask requirement is needed in the school. And if they look at their vaccination rate, if they look at the community spread, and they believe that that is needed for reduction of cases in the school and to keep the school open, then absolutely, they should make that decision. As I pointed out, there's 25% less in cases when that mask mandate was present in the school. I think the schools have done a remarkable job, and some of them have set, the criteria that if we fall or we go above this particular level in cases, then we're going to have the mask mandate reinstated for the schools. But there is a little bit of difference whenever I was very, very concerned about the schools and not having the ability to protect those that were 11 and under because they did not have the vaccine available. Now that is available, and so that's a new criteria as well. But with the spread of the Omicron, absolutely, I'd like for the school districts to look at that, and that should be an option for them.
And could you explain some of the details of the surge plan and what would quantify enacting that? Because I know we're hitting record cases, but what are you looking for that surge plan?
Well, the surge plan is in place based upon the space that we utilized before. The unknown questions are, when does it need to be implemented? That now is not right because the hospitals are not near the level they were previously. We do have more staffing challenges now, so it's a combination of hospitalizations because of COVID and staffing issues, and that determines whether we need to take the step of implementing the surge plan. So that is under development, and we'll keep you posted if that is necessary.
So it's really the only option if the hospitalization spike to deal with the staffing issue using American Rescue Plan funds again to hire traveling nurses? Or is there some other option?
Well, the option is to utilize existing staff. It's available. And for example, there's 5 or 6 hospitals that participated in our previous surge plan.
Right.
And some of those hospitals cannot reopen those beds without hiring contract nurses. That would take assistance from the American Rescue Plan funds. There might be other hospitals that can manage an expansion of beds with their existing staff. That's the survey that we're taking now. So we have to have this information to know what the need is and at what point it has to be triggered. You've got the combination of the fact that because of the rampant spread of Omicron, that you have more absences, you have more that are quarantined, you have more staffing issues now in the hospitals than even you did 5 or 6 months ago. And so we're facing a new set of challenges, and so it's a new equation. We've got to do that study, work with our hospitals to make that determination.
Do you think the 50 National Guard members for UAMS is going to be enough for increased testing? I mean, I know, people are waiting in hours-long lines. I know personally there's a delay in some, maybe days where you could spread where you didn't know if you tested positive or not. Would you be looking into any other clinics or any other ways to spread it, or is this the effort that's going forward?
No, that's a good question, and I need to distinguish it. We put 10 National Guard at UAMS. That's how many they requested. But that, because of the success of that and the needs that I see across the state, when I say we're putting out 50 National Guard, that is statewide. And so, for example, one hospital that has a testing site there in their hospital, they asked me for 6. That's how many they needed to give their staff a break, to be able to move and reduce the waiting time. So we wanted to go across the state, work with the hospital association to see how many that number is. But I assure you that, I'm willing to put out 50 now. We will increase that number if that is needed. And so I'm looking at this as a January of challenge, a January of action, a January of getting this behind us, because I do believe the Omicron is going to pass through quickly, but we have to deal with it as it goes through, and testing is a big part of that, and that's why we're accelerating that, making the National Guards available to reduce those waiting times.
I mean, right now, we're seeing record in positivity rate, active cases, every new cases. What would quantify, needing more help in testing? Because I know right now it's hard to get a test in
Well,
general.
now, we need that now. And so everything meets that criteria. Whenever there's an hour wait, whenever the staff is worn out, whenever there's people that go and they go back home because the line is too long, now is the time to increase that testing capacity and the speed of it, and that's why we're putting the National Guard out there now, and that's why we are also investing in at-home testing as well.
On those at-home tests, did you expect to have them by now? Has there been a delay in getting the at-home tests?
I was very careful when that issue came up. I did not indicate when they would be in because I know of the national demand. And so there is an expectation level that I won't share as to when that we hope that's in, but we recognize that they're not here until they get here, and we're hoping it is soon. We're making plans for it to be soon here, but whenever you look at the federal government can't put this together probably till the end of January, we just want to be able to beat that and get it out there as soon as we can. And the reason that ties into the waiting lines at the hospitals right now for testing, that if you have the availability of at-home tests, then that might solve the problem. It might be a negative test, and so you don't see the need to go into the hospital and to wait in line for an hour. So it relieves pressure on the hospitals if we can have that at-home testing alternative. It gets treatment quicker. It gets people back to work quicker, or it saves them from going to work with an infected status. So it helps us all along the way if we can have an expansion of that at-home test. Dr. Merrill, if you've got anything to say, and let me go remotely. Is there any question remotely?
Yes, Governor, this is Garrett Ferguson with KNWA News.
Yes,
Good to talk to you again. The Bentonville School District is currently tied up in litigation in Benton County Circuit Court over a lawsuit filed on behalf of a few parents. With Judge Fox's ruling, is Bentonville's district able to enable a mask mandate for students and staff, or is that going to have to be left up to the Supreme Court?
It's my understanding that Bentonville is in a unique situation because you do have the Benton County Circuit Judge's ruling that applies to the Bentonville School District. And so that's on appeal. Hopefully that can be resolved in favor of the school district soon, because that certainly goes contrary to what Judge Fox found in holding the entire law unconstitutional. So Bentonville School District is in a unique position that hopefully it can be resolved in the future. Next question.
Governor, it's Brett Raines with 4029 News. A few quick questions. When we're talking about rapid tests, do our school districts have ample supply of those rapid tests, or a test to stay program? We're assuming that that's going to be ramping up. Then also, can you update us on the monoclonal antibodies, the shipments and supplies? I know that's a hot topic. We've seen some governors advocate for states to have the power to purchase those. Comment on that, please.
Yes, first on the school testing, we have 50 school districts that are participating in it. We have an ample supply of at-home tests for that purpose. We'd like to have more school districts participate. That's a separate supply chain for our schools, and we'll make sure that we have those available. And then secondly, on the monoclonal antibodies, absolutely, this is an example of where the federal government occupied the entire market of that therapeutic, and we have to ask for an allocation from the federal government, and they, because of limited supply, they send it out where they believe the greatest need is. So we are requesting a much greater amount than we're receiving. And yes, in every circumstance, the federal government should try to accelerate production, but give flexibility to the states in being able to make their own acquisition and their supplies. So that's just a point of disagreement, but everybody needs to understand we're working very hard to get from the federal government the allocation of those monoclonal antibodies that we need to take care of the people in Arkansas. It is very important that that be ramped up and we get that out, because that's just necessary. And on both of these points, let me ask Dr. Romero for a comment, and then if you want to add anything to the testing side.
So as has been said before, we are having a shortage of these monoclonal antibodies, and more specifically, those monoclonal antibodies that works against Omicron. We're distributing them across the state as equitably as possible. We're trying to get as many shipments as we can here, so we are short on that. The same goes with, so let me also talk about the antivirals. We have a limited supply of antivirals. We are distributing them across the state so that they are equitably distributed. Physicians can go to our websites and see where these are available.
In my communication with superintendents, a number of them expressed interest in becoming part of the Test to Stay program. And so we're working with Dr. Romero's team to open that up to those districts. And one thing to keep in mind is the supply of these, as the governor said, is sourced differently, different supply chain. So we're monitoring that to make sure that we have plenty to support however many districts want to come on board. We're always looking for other sources and in communication with potential sources for the right tests, and we'll continue to do that.
Is there a last question?
Would you ever consider putting in any sort of mask or vaccine mandate for businesses or bars, restaurants, any sort of, guidances back in?
No, we're just beyond statewide government mandate. You look at, my position has been very consistent that we should not be mandating businesses to require vaccines. At the same time, we should not be prohibiting businesses from requiring vaccines. That's an independent of their workplace requirement. And so I'm against the government mandates. I'm for those local private sector decisions that their customers depend upon that safety, their employees do. They ought to have the right to make those decisions. Thank you all very much.